My name is Dr. Dheeraj Gandhi. I'm a professor of radiology, neurology, and neurosurgery at University of Maryland School of Medicine. I also direct the program in neurointerventional surgery at UMMC and also Center for Metabolic Imaging and Therapeutics, where a lot of cutting-edge therapies are performed using MR-guided focused ultrasound. In addition, I also serve in the role of vice chair of radiology. I grew up in India and I did my medical school and residency in New Delhi. Then I moved to United States and I did my advanced training in diagnostic neuroradiology followed by neurointerventional surgery at University of Michigan, Ann Arbor. I was then employed there and then at Hopkins, and for the last 15 years, I've been working at UMMC in this very exciting field of neurointerventional surgery. A vast majority of my time is focused on treating disorders of the brain and spine through endovascular approaches, going through the wrist or through the groin. And a small part of my practice deals with MR guided focused ultrasound, which is a very revolutionary way of treating brain disorders without any incisions. In the endovascular realm, I focus most of my clinical practice on taking care of patients with brain aneurysms, strokes, patients with idiopathic intracranial hypertension, vascular malformations of brain and spine, as well as chronic subdural hematomas for the most part. And in the field of MR guided focus ultrasound, a vast majority of my practice is on taking care of patients with essential tremors, Parkinson's, and also we do a lot of research in other conditions such as neuropathic pain and treatment of brain tumors. I would describe my approach to patient care as one of partnership. A lot of patients that come to us or their families, in case the patient is comatose and unaware, they are facing these life-threatening disorders. And my role at first is to educate the patient and their families about the condition that they have and what options may be available to them. In case the treatments that I offer are the best for the patients and their families, we proceed with careful planning of the procedure, taking care of them at every part of the step of the way to make sure that the surgeries are successful. Beyond the surgery, I see my role as a caretaker for them and an advocate for them so that if they need any adjunctive therapies from other sources, we continue to advocate for them. Early in my childhood, I lost three family members to ischemic stroke. That inspired me to go into medicine, and I was certain that I was going to be working in some sphere of neurosciences. Fortunately for me, as I was graduating from my residency, I became aware of this field that was developing, and it was in an infancy at that time, the field of neurointerventional surgery. Little did I know at that point that it'll become the focal treatment that we would offer for patients with ischemic stroke. So I'm really, really fortunate that I get to do this nearly every week. What I enjoy most about taking care of patients and their families is that nearly every day brings a possibility that you would have one or two patients whose lives would be permanently changed for better after having these cutting edge neurointerventional surgical techniques. For example, one of the most commonly performed surgery in my field is mechanical thrombectomy. We have patients that come in with serious strokes, unable to talk, move a part of their body, or even completely unresponsive. And it's fascinating to see that 50 to 60% of them might be discharged with very little deficit and may go on to resume their normal lives. Outside of my medical interests, I like to spend time with my family. I like to go out running, hiking, and I like to read broadly outside of medicine. It's just really my tremendous honor and privilege that I get to do this, and seeing these patients and their families come in desperate situations and life-threatening with life-threatening conditions, and then many of them go on to have a normal life after these minimally invasive surgeries. That's really been a biggest gift, at least for me.